lesser nephron mass and in future can have chronic kidney disease as well. So although globally the disease is as common in women as in men, less number of women receive treatment. In Andhra Pradesh, and it's not only economic, because Andhra Pradesh, the dialysis is free like everywhere else in our country, but in the dialysis population, 73% are males and the rest are females, because females don't come to hospital or not brought to hospital or just neglected. But on the other hand, women donate more kidneys than men. 90% of kidneys donated across the country are women, 10% are men, but are less likely to get kidneys because of all kinds of reasons, socio-cultural. The lady is very happy to say, I don't want to take my husband's, I don't want to sacrifice him, but is very happy to sacrifice her kidney to her husband. 25% of kidney disease is associated in women with obesity as compared to only 13% in men. So obesity is a major factor in women for CKD and cardiovascular diseases, much more than that in males. So very simple recommendations is most about prevention and screening. Assessment of kidney function, a very simple blood test called serum creatinine, and a urine examination as a standard test for all women from preconception and antenatal care till the rest of their lives. Increased awareness of kidney disease as a risk factor and more public awareness programs to be done. Follow programs for those patients who have been diagnosed with chronic kidney disease, because just giving a diagnosis and they're then lost for follow-up. Monitoring of such individuals born preterm or small for gestational age and continuous monitoring toward the life, especially in the female population, because females are disadvantaged because they are born with a lesser kidney function compared to males to start with.
15% lesser than males as usual, because of a lesser nephron mass and a smaller kidney. So implementing systematic screening for kidney disease risk factors such as diabetes, hypertension, and obesity in women throughout their health course. They are simple things that can be done to decrease the rates of kidney disease in women. Thank you very much.
Thank you very much. Yeah. This way. Okay. Thank you for this opportunity. I would like to focus on women and diabetes in the rural area. So we make lots of policies, and most often it's reaching the people in the urban areas. So I would be really happy that the government make policies to reach out to the 70% of our rural population, and only 30% of doctors who are there to take care of them. So if we can have a policy where more and more people, particularly the healthcare professional, should be given training to say screening diabetes, the screening for NCDs, because we are moving more towards NCDs more than the infectious diseases. And we are experts in tackling the infections as we have seen in COVID management. I think if we have to concentrate on better health of our nation, NCDs have to be tackled, and we have to have a policy to take care of the rural population through the rural healthcare professional. So this is what I would like to say, and more of that I have written and given you. Thank you, ma'am.
This side, we'll just move. Yeah, you can. Okay, so you can. You don't want to speak first. No, you start from there. No? Okay, so can it go like that? It will go like that.
I would like to listen to all of you because we take care of your.
Sorry.
Yeah, good afternoon, everyone. Yeah, subject to correction, many a time the policies so far have been, if women's health means mostly concentration on nutritional aspect and gynops part. So as a physician, all the diseases like hypertension, diabetes, anemia, everything, they are routed through us only before going to specialties, except for 5 to 10% nowadays. So we are in more touch with the women and men everywhere. So my suggestion is that all the statistics that are made in the textbooks is Western based. We don't have any Indian context regarding the statistical health issues of women. But what we find in our day-to-day practice after 40 years is a lot of women suffer from all the diseases, maybe 5 to 10%, this variation is there. So, but whatever some of our colleagues' suggestion of all those cumbersome procedures, it's very difficult even for the government to implement also. But simple thing like screening camps, hypertension, you don't need any investment. Even simple blood sugar estimation, you don't need anything. Just simple urine examination to find out where any kidney problem is there, you don't need much investment. So from our side, as a chairman of API Telangana State, we extend full cooperation to Her Excellency, whatever the recommendations you say that we can, because we have nearly 14 district branches are there, all our physicians are there, they are more acquainted with all these diseases before we send to the specialties. So screening camps both for hypertension, diabetes and kidney disease where we can, with least investment, because if you go on waiting for HbA1c levels, it's not possible even in urban areas, forget about rural areas. So let us concentrate more on wherever if we find some focal areas where you find a lot of hypertension patients or some areas diabetes patients are there, then we can concentrate on that particular area and get some special camps to see that what could be the cause for that one. So in that way, I think government can plan with recommendations of Her Excellency. So we are there at any moment to help the community and the government from our side. We can depute, we have all other contacts are there. That's my suggestion.
So, one second, Dr. Sairam, we will go a little like this and then come back to you. So, you can keep the mic. Can we have Dr. Vimi Bindra share her?
I'm a gynecologist, but I am here to talk about a particular condition which affects women. It is called as endometriosis. 50 to 60% of women have crippling pain because of endometriosis, and 40 to 50% patients may have infertility as well. It affects 1 in 10 women, and approximately 42 million women in India are suffering. But it is a highly underdiagnosed, underfunded condition which is not getting the attention which a diabetes gets. It is as common as diabetes, but if we look at the statistics only in women, the prevalence is same as diabetes. But hardly people are aware of it. And it's not only the awareness for patients and community, it is also the awareness for doctors, because these patients are treated as if it is only a reproductive organ disease. They treat their ovarian cyst, but this disease, approximately 33% patients may have bowel involvement. There may be a 5 to 10% of urinary tract involvement. We might lose their kidneys because in 40% of the patient, it is a silent disease. So patients, sometimes they report as a hydroureter and all that, and there may be a residual kidney function of only 10%, and she might land up with nephrectomy if endometriosis is not looked into. So awareness and many myths surrounding endometriosis make this condition difficult to diagnose, and it is not addressed at the appropriate time. And it is a slowly progressive disease, not a cancer, but it is a locally invasive disease which invades the adjacent organs. In turn, patients have poor quality of life, absenteeism from work, productivity is less, they are not going to the higher jobs categories as Karuna ma'am. Yes, torrential pain, and they have been dismissed not only by family members, by doctors as well. You get married, have children, you will be fine. This is what my patients come and tell me. Patients are operated multiple times, 6, 7 times without any relief. There is also lack of experts for excision surgery.